Generally, illnesses like fever and cold are taken for granted as common viral conditions by people. The normal tendency is to take mild treatment or to just take precautions until their condition improves. Yet, a dangerous variety of the common fever and cold, which begins with the symptoms of the common cold and develops into a fatal disease, is spreading throughout the world, killing thousands of victims. It is very important that we gain some knowledge of this particular infection, which has become a global threat to human health. This new phenomenon is known as pandemic influenza H1N1. When an infected person coughs or sneezes, the germs and droplets of saliva released into the air are inhaled by an unaffected person or is touched by his hands, which, when it makes contact with his mouth and nose, will give him the infection. Symptoms of the disease will appear in an infected person within a period of 2 to 7 days. These are fever, cough, sore throat, body aches, and a running nose, which are the major symptoms. Some victims also experience vomiting and diarrhea. These conditions can cause pneumonia, which in its acute form can be fatal. Although it can be cured and pass off as a common cold, its potential to develop into a serious condition demands a great deal of care. A vaccine is used as a prevention from the disease, but vaccinations are given only to high-risk groups of people. The process of prevention of pandemic H1N1 influenza also ensures protection from the patient. This can be divided into 2 separate groups. The first group, those who are not infected, should keep away from those who have symptoms of influenza. Avoid frequent visits to crowded places. Keep both hands clean by washing them regularly with soap and water. Use a handkerchief or tissue to cover your nose and mouth when coughing or sneezing. Dispose of used tissues to a safe place. And the handkerchief used when coughing or sneezing should be kept clean by washing it regularly. If you do not have a tissue or hanky when coughing or sneezing, use your elbow to cover your nose and mouth. It is also important to avoid unnecessary contact with your nose and mouth with your hands. Although it is not necessary for an unaffected person to wear a face mask, it is essential to use a mask when dealing with an infected person. The second group, that is those infected with the pandemic influenza H1N1, should avoid crowded places, confine themselves to their homes, take about a week's rest, and wash their hands regularly with soap and water. And always use a hanky or tissue when coughing or sneezing. If they don't have a hanky or tissue, as we said earlier, they should use their elbow to cover their mouth and nose instead of their hands. It is also important that the tissue used when coughing or sneezing should be disposed of safely. And the hanky or hand towel used should be washed regularly and kept clean. Also ensure that a mask is used to cover the nose and mouth to prevent the spread of the disease to others. Special care has to be taken in the case of children below 2 years of age, those over 65 years, pregnant women, and also those who are taking long-term treatment for chronic diseases such as diabetes and respiratory diseases. While these are being cared for, any indication of one or more symptoms of the disease should be referred to a doctor for treatment to ensure that the disease will not reach serious proportions among these high-risk groups. Serious attention should be paid to cold and fever conditions that may occur during this period in order to help early diagnosis. Observing the general principles of fresh air, good health habits, nutritious food, adequate sleep, and being physically active will help you to ensure protection from the disease.